I don't know if it has it now, but it doesn't matter. Let's do this one and then you guys can be on your way home or wherever you are, okay? This one here has a trigger. This is the trigger right here. I mean the counter. The counter is right here. Um, right here. There's a counter. Yeah. So the counter is over here. Sorry, I'm reading some messages right here. And this one has 14 up to 60. It gives you 60 right here, 60. And then what you want to do is you want to realize that they have a trigger right here. There's a trigger right there. So what I recommend you know is that, first of all, it comes like this. It has 3 parts to it. You put this little can here, so you could have this Stravati can, or you could have this Pariva can, whatever it's called for you, that's your prescription. Or actually Combivent, there's Combivent, which is orange, okay? It also doesn't have any steroid inside. You would put that little piece inside and press it all the way down. Then you would fit it right here, right? And then what I recommend is when you're twisting this, keep this cap closed, right? Because if you don't, when you twist, you're gonna trigger it, okay? So this here, take it like this, and then you would twist it like this. You see, twist. It only goes one way. Twist one time, then you open from here. See this? You open from here, and then you go like this. You press it, and it will be in your mouth, and you will see it come out. That's how it is. So close it like this. You would twist it like that, and then you would open it, and you will go exhale everything out. You see that? You see it? Or the air comes out if you do not hold your breath properly and pull it. So you have to make sure that you twist it, and then you like this, and you put your whole mouth in here, all the way to grab to the bottom, and then you go. And that's it. This is very easy. I don't know. I'm not sure if I can hear anybody, if they can hear me, but I am trying to hopefully get a few people to listen to me on YouTube. And I do have a few people, but I did not know they cannot hear me. I went through a whole training on side effects and making sure that people understand that when you have side effects, talk to your provider, make sure that they are familiar as to why you're having these issues, and not to make sure that you're not in a flare. If you're in a flare, maybe the flare makes you feel like you can't tolerate the medication, depending on your symptoms. Obviously, if your throat is closing in, that's dangerous. Stop your medication, go to the emergency room. But the last thing you want to do is stop your medication, not get any guidance, and come back with a flare, really actually come back with a flare, and now you're missing your maintenance. So the reason I'm on here today, my name is Dr. Mkono. I was going to answer, or I have answered on TikTok, a lady who asked me about, oh, I'm scared to take those medications. I don't want to take those medications. And I said, which one are you scared more of? Being in the ER, or, you know, asthma is not going to go away because you're scared of it. You have to tackle it. You got to talk to your provider, see what's going on, find out what the solution is. Because not taking it, not agreeing that you have something is actually more dangerous to me. Because I see people that, were diagnosed last year with asthma, and then they show up and they don't know what that is all about, and they're back in the ER. That is very costly. So it's costly, it's dangerous, and after time, period of time, your lungs also burn out. And we talked over what is a burnout lungs that are not cooperating with you, and they just permanently are disabled, and they need oxygen to supplement them because you've completely destroyed them, or you get pneumonia after pneumonia, bronchitis after bronchitis. It's just a lot of inconvenience. You don't just get on inhalers. There's a reason that we put them on. Sometimes it's temporary because we find out that maybe it's something wrong with your heart, not your lungs, that's causing it. Then we stop you. But we have to have a consensus. You have to meet up with your doctor, whether they are adjusting your medications, adding to your medications, removing medications, changing your medications. adding combination. They have to titrate. They cannot just look at you and come up with a plan. Sometimes the plan is too strong or too weak, and we have to adjust. These inhalers come in different combinations. You cannot just assume because this one is blue and the other one is blue, they are the same. They are not the same. These happen to be very similar, but some of them really just have a rescue inside of them, and you need to know why you're using your rescue very often. Um, Hi. Oh, thank you. I think those are good comments. Thank you. I did do a live. I'm talking to the YouTube people. And unfortunately, because I'm like technically challenged, I'm trying to keep up with the AI and everything else, but I do not know how to set up YouTube. I'm not familiar with it. I am trying to learn. I did do, I think, a very thorough evaluation of teaching you guys. I've gone totally to make up for all the weeks that I haven't been on here. So if you're on TikTok, go on there and maybe look at the reruns of this show today. I think I over answered this lady's questions and hopefully told her to go back to her provider and check out why they're having all these concerns. Instead of just stopping your inhaler, you should talk to your provider. We need feedback to take care of you. If we gave you too strong of a medication, we should get a chance to reduce it. If we gave you too little, we should get a chance to increase it. If we didn't add all the ingredients we need, we should get a chance to change and upgrade your therapy if needed. If you're dealing with a flare, we need to get a chance to say, okay, you need to be on your maintenance, but we also need to add a regimen that will take care of the acute phase, which is we give you steroids, antibiotic, IV now, right? Remember, we can give you steroids in the IV form or we can give it to you on here. These steroids are not the same as the one in IV form or pill form because they're very different. One of them is very, very potent, and we don't intend for you to stay on that very long. We intend for you to be on inhalers on the long term because that's the solution that's safer. And if you follow the directions of technique, being the priority. If you, there's no discussion with me if you don't know your technique, because what's the point? If you get zero in, it doesn't matter if you're applying it at the right schedule twice a day, it's zero in. And then you're not going to be covered and you're going to have a problem. You may have an inhaler, but you don't have it inside of your lungs. So technique is first, then we build on the schedule. Twice a day is twice a day because it's said twice a day, and that's how that medication is used. Once a day is once a day. Don't make it twice a day, once a day, once a day, twice a day. Don't do that. It doesn't make sense. They do not work like that. You wouldn't, if Tylenol is every 24 hours, you wouldn't make it twice. I mean, maybe if Tylenol is every 6 hours and you have pain, you wouldn't make it stretch to 24 hours or 3 months, would you? You would dose it the way it's supposed to be. Same thing for the inhalers. If you forgot, go back to your provider, go back to your pharmacy, find out. Because I can tell you this much, one puff of this inhaler is not maximal dose. Two puffs is not. Maybe after 2 weeks of you using it twice a day, this particular one is when you get to the full therapeutic dose. And therefore, if you stop prematurely, you will never know it works. However, if your breathing is compromised and you feel like you can't breathe, maybe you're in a flare or in an attack. We need to deal with you in a bigger, more safer environment, maybe in the office with nebulizers going home and steroid pills, or maybe in the ER, steroid injections, admit you, do more for 24 hours, settle you back down to earth, maintain you on the way out, soft landing at home. It all varies. So I just need you guys to know that. And then it's not one size fit all. One inhaler is not one size fit all. One patient is not exactly cut and paste every patient. So you need to know that there is a difference in a patient who has asthma and has reflux, because the reflux is making the asthma worse. So you got to attend to both asthma and reflux. You got to take care of both, really, because asthma will get worse with reflux. Postnasal drip and asthma, postnasal drip, reflux together is a different patient. We have to give you recommendations about allergies and postnasal drip management, and then also take care of your asthma. Very different things. So you do need to definitely not assume I'm your doctor. I'm just predicting. Most of you, some of you have allergies because asthma is an allergy disease. If you're supposed to be on a Montelukast, take it. You know, if you're allergic to it, you're scared of it, tell them give you a substitute over the counter. Maybe not Benadryl, loratadine, something for the allergies. So that is very, very important. And I am going to do the most difficult inhaler right here. For me, it was, and different parts of the world call it different thing. I learned Europe, they call it turbuhaler. Turbuhaler is it is. I call this Pulmicort Flexhaler. Some people have something similar. It's pink. It's called Asthma and Twisthailer, right? No, they are not. Absolutely not. But I feel like even on my day off, I have to work. I do have to work. So they are not. Absolutely not. Okay, now we're in a different mode. I don't know. I do not say that. I do not say private information. Anyways, we're going to this one. I asked for someone to follow me on YouTube, but then I got someone, one of those situations. So, anyways, I just want you guys to know I do put tags on my patients' inhalers because I feel like some of them need daily reminders. So, this one says 2 puffs twice a day because this is a 2 puff twice a day inhaler. Okay. So, how do we use this? This one is a little tricky. I'm going to come close. There's a groove over here and there's a groove over here. This thing twists from here, not from here, from here. The brown and the white on the bottom. This also has something on top. You're not twisting from here, you're twisting from here. You see this? This part. Now, you wouldn't do this to your inhaler. I'm only showing you to demonstrate that it's going to move. See this? It's going to move like this. It's going to move like this. Okay? So when you have this particular device, I need you to know that you grab it from here, like this, right? And you grab this, 2 separate grabs, and you're going to go like this. Twist one, and then twist back. Okay? Some people say forward, backwards. It's very confusing. So I'm only showing you because it gets confusing. You have to twist it, and then the click you hear, it means that it's dispensed. So listen to it. You see that? Look. You see that? Twist this way and twist back. Or you can say twist this way and twist back. You see? Twist this way and then twist back. Or you can say twist this way and then twist back. This and this, brown and white, bottom. Don't hold up here, Maybe you could hold up here. You could actually, but hold like right here. All right? So when you get this, you take it out of it has a cover. Mine has lost a cover because it's like 20 years old. Literally, it's almost 20 years old. And I've been using it that long to teach. I don't know. I don't think some countries don't even have this anymore. But for people who are pregnant, the women, I used to prescribe this Pulmicort, which basically has budesonide inside. Budesonide is the medication that is inside. And I would do budesonide for the pregnant women in this because budesonide has the safest category for people who are pregnant. I'm not saying these inhalers are bad and you cannot use them. Please don't run away with that. I don't want anybody to get in danger, oh. Hey, what's up? Oh, goodness. Well, I did lose you guys. Okay. Sorry. I don't want to say anything that keeps you guys in a situation where you now stop. Do not do that. When you meet somebody, you don't stop your regimen because a doctor said so in online. You have to be safe. You have to go and talk to your providers and make sure that you're safe. Take the information, write your question down. You're learning. Your situation is different. You may have asthma alone. You may have asthma and then congestive heart failure. God knows what you have. You just need to know that I'm here basically to promote the education of technique of the inhaler. Management, though, we cannot manage you through here. I just want you guys to know that. So this is, again, like this, and then like that, and then like this, and then like that, right? So when you get this, your dose would be, you get it out, bring it out, you twist one, and then you twist two. You hear the click, you exhale. Don't panic if yours does not whistle. Mine is a demonstration device. I forgot to tell you guys. This is a demonstration. It will whistle. Yours will not. But the technique is exactly the same. You would rinse your mouth after because these usually have budesonide steroid inside or steroid mainly inside. you would want to use that twice a day as scheduled. It's a twice a day medication, and you'd make sure you rinse your mouth after. So we have learned a lot of information. The only inhaler that I would have loved to show you guys, and I didn't, is the Spiriva. And that is because I can't remember where I put it. I don't know. I have so many inhalers. I'm a bag lady, you know. Um, if I could find it, I would show you, but I don't think I will find it. Oh, there it is. I found it. Okay. So let's complete it, because at some point you guys will have all the inhalers and I can refer you and fast forward to this cutie pie. This is the little Spiriva. Believe it or not, it's the same as this. But the directions can confuse people, especially when insurance switches this one and moves you over to this. You use this one puff. This is a two puffs. One puff and then another puff. In the morning is one dose. This one, usually that's how I prescribe it, right? This one is one capsule per day, right? So you can see that somebody can come from here and then use this one too low, or use this one. Maybe they won't confuse it and do these two puffs, because each pill is per day and they only give you enough for those 28 days or 30 days, okay? So I'm going to show you this one. This is how Spiriva was when I first came in practice. See? So it looks like this. I'm going to show you guys. You put it right here in the center. Right there. The pill went inside this hole right here. So there's a pill. This pill is kind of, you see, it's already beaten up. You would drop it in here, see, right there. And then you would take this pill. You would now, there's a little window. You would go like this, okay? Yeah, and then you would, right? And then you would crush. You close it, and you know, you can definitely just close it like this, as long as it's closed, right? And then as long as you close it, it's closed, you can, if it's closed and you do this, it will open. If it's closed and then you do this, it will open. But it's also crushing that little pill inside. There's like forks in this little green thing. It crushes the pill. And then the pill, you then have it inside, it's crushed. It opens up the powder of the pill. Now you exhale all the air out. And if you were not following me from the beginning, or you're part of YouTube and you were not listening to me because you couldn't hear me, I'm so sorry for the YouTube people. But you would know that I really recommend you to exhale so that you can get a full breath of medication and inhalation at the same time. If your lungs trap air and you take a breath without, you'll probably get it. But I think some people really trap air where it's already 90% full and you need to take a deep breath. It's not gonna be a deep enough breath. So I always recommend deflate your lung first and then accept the medication with a deep inhale. Like that, okay? Exhale. And you exhale, you inhale, you count to 10, because you want that medication to, you know, be delivered to your lungs. And this little pill has been beaten up because I've demonstrated it. It will have holes. See there? Because it's been crushed, right? So obviously if you did this and you didn't crush it, you will get no pill, right? If you do this and then you don't do this, the pill will come out whole. You will not get your medication. So it's very, very thank you for that beautiful comment. Now there you recovered yourself. Good. So anyways, I would like you guys to obviously always keep me in hand. Always remember me. Always ask questions. Always know that if you're going to ask questions, I will answer them. At some point, I'm reading your questions. I'm actually monitoring, making sure that nobody does anything crazy on my conversations. But at some point, I'm delayed in answering you. Some of you guys is one person that has asked me a question about being a firefighter and how to pass their class and their testing and their pre-op and all that qualification for being a firefighter. That's a big job. Obviously, those doctors have a big job in clearing you and making sure you're healthy to be a firefighter. But usually, that is not a job for someone who has lung disease, because obviously people even with healthy lungs will have a problem running into a fire and doing these really, I mean, that job to me is much more difficult than my job. And I value the firefighters, and I think I know why you guys are screened and have to be healthy people, probably very healthy and very young. And your lungs, if they're not healthy, they do not call for that type of disease. You don't want to go in to save someone and then your lungs fall apart. So I'm definitely going to do a video on that one. If you haven't followed me in TikTok, follow me in TikTok. That is where all the library is of everything crazy I've done out there. It's all there. It's all documented nicely. I'm usually well behaving, nice person. And sometimes I'm not to my patients who know me. I'm very strict about what you need to know, and therefore it comes off wrong sometimes for some people, because most of the time, asthmatics, you guys feel like you know everything, COPD, you know everything, but you're in front of me and you wanted me to fix a problem for you, and I need to begin from scratch. If I begin above this, you miss all that, and we'll never come to terms. We'll never get you better. Technique comes first, and then schedule, and then consistency. Put everything next to your toothbrush, that is maintenance. Carry your rescue inhaler with you. Know how to use it. Learn how to get a spacer. Accept if you do not know how to. If you're orienting somebody who has dementia, they can't do everything. You can do this, or you can ask them to switch you over to a nebulizer format. I do not know what else would be better than spending my time with you today. I am going to do a lot of paperwork. Today is my day off. And the paperwork involves all those medications that people get denied. It is so painful. They get denied, and then I have to fight. And I fight if your medication is not covered and you don't have a formulary. If you do have a formulary list, which is what you should take to your doctor, take it to them, because it tells them what inhalers you should be prescribed, and therefore then it is cheaper for you. If you're looking for a valuable video, you should check out the video that says this is a cheat sheet for getting your medications prescribed and cheaper. I have listed all the possibilities of options of what can make your inhalers cheaper. Please do not make it zero inhaler, because zero inhaler is not cheaper. Zero inhaler is more expensive because you got to be in a hospital when you get sick, and that is not cheap. And so I need a video that says, yes, you got to figure out if your inhaler is not acceptable for you. Figure out what you need to be on. Your doctors can say, let's find a cheaper one on the panel for your insurance, bring them the form, make it easy for them. Or they can say, let's switch it over to nebulizer. You need to be treated if you have asthma. If it's come before, it will come again. If it's made you go to the ER, chances are when you get sick, it will make you go to the ER again or cost you more. I advise you to be safe, and definitely don't take me as your doctor. Take me as a wild doctor here trying to teach passionately about the inhalers and their value, because they do help. And if you figure it out and you think it finally clicked, let me know. And if it didn't click, just go to your doctor and ask them, okay? Yeah. So, oh, hello there. Hi. Hi, doctor. Oh, okay. Um, Yeah, do an asthma test when it fails. Sometimes we start you on an asthma test, sometimes we do it after, but we need to take care of you first. Sometimes it's not a matter of us finding out that you have asthma. It's that if we think you have asthma, we treat you like asthmatic, and then we can come back at the end once you're settled and see what you truly have. So that's questions. If you guys have questions, I will answer them. Hmm. Well, I got someone very interesting in here. Okay. Anyways, so that's part of what I do, I guess. I'm gonna have to deal with everybody, the means, the nice, the wild, everybody. Um, thank you. I don't know if this person is there, but thank you so much that you say it's helpful. I'm very, very honored to be here, and I'm honored for the feedback. When you guys see me, wherever you see me, encourage me, show me that you're learning. If you've passed that phase, and you now are a pro, come back. If they switch your inhaler and you don't know how to do it, I'll help you.
when you're running and you're wheezing, I don't know, that person maybe is gone because it's been a while. Um, Use your rescue inhaler. Find out why your inhalers are not working. Maybe it's just a matter of maybe you have other things going on. You know, don't forget to get a chest X-ray for those people who need a chest X-ray. Don't forget to get a chest X-ray if you got it last year and this year it's different. Your breathing is different. Things are changing. Ask for another chest X-ray. Follow what you're supposed to do. Okay. Try to do the basics. If it's not right, it's your lungs. Tell your doctors. Don't just sit on it because sometimes it's treated like asthma and it's something more dangerous than asthma. And that's where the x-ray helps. Now you're on Trilogy, Air Supra, and Nucala, which means that they did the Trilogy once a day. It didn't work. They added Air Supra. You were using it very often. You were always sick. And they said, okay, let's try Nucala to suppress it, a biologic. Makes sense. Just make sure that you use your rescues and ask them to assess you. Some people really have very bad asthma, and I'm not going to lie. And that's the patients I should be seeing. And the majority of you, though, don't. So you just don't want to take inhalers or don't think or have faith in them unless they inject it in you and all kinds of stuff. But they are like, I would say maybe 5 to 10% of my asthmatics that are really needing more than what I'm doing here. But majority of you guys, this should suffice. As long as you follow up, they can upgrade your inhalers and give you um, better management, keep you away from the hospital. The whole goals of asthma care is to keep you away from a hospital, away from pneumonias, away from ventilators, away from, and into your job, being a mom, being a dad, being a provider, being whatever you want. If you're a college student, going to school without interruptions, if you're traveling without spasming out in Jamaica on a vacation, whatever you need to do. Anxiety can coexist with lung disease. It's acceptable. What you need to do is treat your asthma, take care of it, and treat your anxiety concurrently. Once your asthma is well controlled, some people really do well where their asthma takes care of the anxiety, the control. But that is just neither here nor there, and I just don't want to be a provider that is. Mental health is real. I don't play around with it. I definitely respect it, and I'm so glad. I think two people really listened all the way to the end, and I want to say thank you for keeping me company. Nice meeting you, and I hope you will be the one to give me all the feedback. Let me know that you're the one who stayed and gave me all the inspiration of not staring at myself and talking to myself for so long. I really appreciate everybody who's on here. My name again is Dr. McConnell. I'm here to make asthma simple, COPD simple, teach you guys common sense things that you should be doing, and giving you the faith in understanding that whenever you are sick, there is a lot of help and there is prevention. You need your lungs for the rest of your life. Don't abuse them when you're young. Don't smoke, don't vape. Keep them healthy, breathe healthy air. Follow up with your doctors if things are not right. Don't wait until things start flaring and you're going to urgent care. If you need urgent care, you do. Flare-ups comes from infections. Infections make things interesting. So if you can avoid infections, you're going to do good. If you can avoid allergies, if you can get a mattress for your bed, if you're an asthmatic, to help you not get allergies from your mattress, and pillowcases that are good and protective. Carpet is not a good thing for asthmatic and lung disease because it has dust inside. Keeping your environment as clean as possible, using control like setting as far as what goes in and out of your house. Special filters for asthmatic is good because it filters out all the dust. Allergy medication if you need it, reflux, post nasal drip, all that stuff that irritates your lungs. And I think you'll do well if you follow up with your doctors and they find the perfect regimen for you and control you. I think you'll do well. And if you don't, we will escalate you to whatever you need. If it's Nicala, Fasenra, whatever you need. And we definitely don't want you to feel bad if you get escalated to that because, protecting your lungs is key. We don't want oxygen later in life. We don't want to abuse our lungs. We don't want them sick. We don't want to be in a hospital. No one likes to be in a hospital. And I wish you all the best and thank you so much. And stay tuned. If you are going to be living in Florida, you can see me very soon on UConn Virtual, which is opening up very soon, God willing, and then I can see you there and I can be your provider, hopefully, if you live in Florida. And if not, then your provider could be in there from wherever and they can do just the same, if not better. I wish you all the best, okay? Take care. I'm gonna say bye first to YouTube. I'm sorry if your video doesn't have everything. We've been on here for like, I think 2 hours. I've been on here for about 2 hours. That's the longest I've been.
And so there's a lot of information. If you can go to TikTok, you can get the full information. If you can't, then next time. But I do have a lot of videos I've done on both um, TikTok and YouTube that will give you bits and pieces here and there. And maybe you can meet me next time. Okay? Thank you. Bye.